before COVID-19, or outside of the Reopening Ontario Act, there is the Health Protection and Promotion Act, and that's the public health legislation in the province that does give certain authorities to medical officers of health in their jurisdiction. So throughout the COVID-19 pandemic, you did see things such as a Section 22 class order that required people to isolate if they thought they had COVID or if they did have COVID. So that Section 22 order is under public health legislation that predates COVID-19 and is there for lots of different communicable diseases that will still be available moving forward. It's fairly restrictive, and rightfully so, because I think we're always very cautious when issuing orders or having to use more restrictive means to protect public health. The Reopening Ontario Act did have provisions that enabled medical officers of health to issue letters of instruction, and so some regions did see MOHs issue letters of instruction, so that is currently no longer in place and won't be in place in the future if we see a surge in cases. So there are still some tools under our routine regular public health legislation, but those tools kind of specific to COVID-19 that are a little bit more general, we won't have available unless provincial legislation is enacted again.